Good evening, good afternoon, and good morning. This is the 1749th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. HUANG WEI LING from Brazil. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of 3 homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. All these sessions are going in a good way, and we are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends, and whether he be a homeopathic lover or homeopathic doctor or a student, you can do it. And the purpose of this forum is to take homeopathy to every home around the world. And let me come to today's guest. Today's guest is Dr. HUANG WEI LING from Brazil. And Dr. Ling was born in Taiwan and raised and graduated medicine in Brazil and specialist in infectious and parasitic diseases. And she is an acupuncture specialist, as well as she is a very good pain and management uh, therapist, and she is a general practitioner and paternal and internal medicine, and she is a nutrition therapist also. She works from say 1997, and she works with the approach of the treatment of chronic diseases in holistic way, with the treatment guided through teachings of traditional Chinese medicine. She is an author of Theory of Constitutional Homeopathy in 5 element based in traditional Chinese medicine. And she is the author of more than 230 publications about treatments of variety of diseases uh, and and the internal energy. And doctor will be talking about a very good subject this evening. Can the medications we are prescribing cause myocardial infections? Big questions to all, and let us see what doctor has to say about it, and let us see what the answer is. So we proudly welcome Dr. HUANG WEI LING. Welcome, madam.
Thank you for introducing me, Dr. Danesh. I would like to congratulate IFPH for today and all these continuous conference. Today is 1,729 continuous sessions, and I would like to congratulate all this group for these efforts to maintain all this continuous education. I would like to share my data show now. Can you see my data show?
Yes, it's visible, and you can make it big. Okay, it's fine now. It's fine. Everything fine. You can go ahead.
Okay. Today's title is Can the medications we are prescribing cause myocardial infarction? This subject was written and published last year, and it is regarding one specific patient that will present his history throughout this presentation. And this subject could be happening in the whole world today, and this is what I want to share with you. But the knowledge that I wanted to share will be following traditional Chinese medicine that the most medical doctors and homeopathy doctors are not studying. And this is very important to us to understand the mechanism of myocardial infarctions nowadays. According to Hippocrates, the father of medicine, he said that foolish the doctor who despises the knowledge acquired by the ancient. For this reason, I'm using the reasoning used by traditional Chinese medicine and Ayurvedic medicine that exists for more than 5,000 or 6,000 years in this globe. And it is following Samuel Hahnemann, the creator of homeopathy, that exists for about 250 years. Homeopathy around the world is the second most prescribed medication. And around the world, over 200 million people are using homeopathy. But these medications that I'm saying, this title, is not about homeopathy, is about the high concentrated medication, okay? And in the United States, over 6 million people use homeopathy. And in Canada, about 10 million people use homeopathy with satisfaction rate of 83%. Myocardial infarctions occurs when there is a decrease or a complete cessation of blood flow of blood in the myocardial tissue. According to Western medicine point of view, there is a necessity to have narrowing of the blood vessel to occur myocardial infarction. But nowadays, we are facing an increasing rate of myocardial infarction in the population in this world without any obstruction. And what can happen in this myocardial infarction without arterial obstruction? And the signs of heart attack are chest pain, vomiting, sweating, and dizziness. And nowadays, it's happening not in the older people, but almost in children and also in young people. Here are some publications that are showing that myocardial infarctions among young people are increasing in Brazil. And some studies showing in India that patients that are using contraceptive pills are having heart attack also. And here is another publication showing that a woman of 18 years old died after myocardial infarction. Throughout the history of medicine, we know that after the implementation of Flexner report in 1910, changing the medical curriculum, firstly in the United States and in Canada, showing the most saying that it's considered scientific only the medication, high concentrated medication produced by the pharmaceutical industry. And all the medications used until then, such as phytotherapy, homeopathy, and other medications were considered unscientific at that time. And the majority of schools of homeopathy and phytotherapy, osteopathy, and other Chinese medicine were needed to be closed. And only 20% of homeopathy schools at that time maintained their functioning in the United States. And all these implementations are happening until today. Most medical faculties in the world are following Flexner, saying that the only medications that we need to use and considered scientific is produced by the pharmaceutical industry. But what is happening nowadays that is increasing the rate of myocardial infarction among the most population in this world, mainly the young people and others. This is what I want to show to you. And this is an article that I wrote in 2021, showing what Flexner report did in our medicine after 100 years of implantation. In this article, I'm showing that the medical faculties are using these rules implanted in 1910, but some alterations changed the necessity of have alterations in this implantation, because there were alterations in the energy pattern of the human body that's predisposing the side effects to the use of any kind of high concentrated medications nowadays, such as anti-inflammatory medications, antibiotics, antidepressive medications, and many others medications that are used nowadays by the Western modern medical doctors, that is not studying the energy part of the human body that's studied by the traditional Chinese medicine. And all these alterations is caused by the implantation of 4G and 5G technology that is invisible to our naked eye, but is causing a damage in our energy in the human body that the majority of medical doctors in this whole world is not aware of this damage in the body, and is still prescribing the medication that is harming even more the human body, because we are facing a new global immune deficiency since 2014, 2015. As I did in a research in my clinic in Brazil, from 2015 to 2020, prior to the COVID-19 pandemic, showing that at that time, analyzing 1,000 patients in my clinic in Brazil, I showed that 90% of all my patients were in the lowest level of energy in the 5 internal mass organs. That corresponds to the 5-element theory of traditional Chinese medicine that I will explain to you throughout this presentation. And this is the article showing that we are facing this new global immune deficiency. It was published in 2023, but we are facing this global immune deficiency for about 10 or 11 years. And that's why we are facing all these alterations in the pattern of disease that we are treating nowadays, because in the past it was very rare to see young people dying or having myocardial infarction or cancer, or so many anxiety and depression, or even children with all these alterations, children with autism mainly. In the United States, every 31 children born during this period have autism. And in the past, we do not have all these disease that we are facing nowadays, such as thrombosis, strokes, and these innumerable cancer disease in any kind of age. And what is happening nowadays is that the majority of people nowadays, these are the chakras energy centers that's studied by Ayurvedic medicine. They exist in our body, but they are not visible to the naked eye. They we know that they exist. They are considered batteries of our body that sends energy to the normal functioning of the whole body. And these chakras, these 7 main batteries. This is the first, this is the second. The first corresponds to, there is a correspondence of these chakras with the 5-element theory in traditional Chinese medicine. This first corresponds to liver, the second corresponds to kidney, the third corresponds to heart, the fourth corresponds to lung, and the fifth corresponds to the spleen. And memory and concentration is responsibility of the kidney, and the spirituality to the liver. And as I'm showing in the research that I did in my clinic in Brazil, the majority of patients nowadays in 2025 are in this pattern, independent on the age group, independent on the country that they are living. They are having this type of alterations, and this is caused by the influence of the electromagnetic radiation. Not only this, but all the alterations in the foods and emotional. But nowadays, the third cause of this loss of energy is the implementation of the cell phones and computers, and the implementation of the Wi-Fi, 4G, and 5G technology. And this tree-like figure is a tree that I created when I begin to study traditional Chinese medicine. And at that time, all the knowledge of traditional Chinese medicine were only in the China, in the East, and Western modern medicine in the West. But they do not have communication. They seems to see each other like a very different medicine. But as I started to study, I realized that they are not different. They only are different parts of the same coin. This one different face of the same coin. The traditional Chinese medicine studied all the energy alterations before the production of some disease. Which energy alterations need to form diabetes, needs to form anxiety, needs to form depression and cancer, etc. And that's why in all my articles, I'm showing which are these energy alterations leading to formation of different kinds of disease. And nowadays, I wrote more than 300 articles that are all online, showing which are the energy alterations presented in each disease. And in this tree-like figure, I'm showing the part above the earth and the part under the earth. The part above the earth is what we can see by the naked eye, and is the part where Western medicine is focusing their diagnosis and treatment. This part has a trunk with several branches. Each branch means one medical specialty, and coming out of each branch, you can see many leaves. Each leaf means one disease treated by each medical specialty. And myocardial infarction is considered a leaf level of a cardiology branch, for example. But okay, but in traditional and in Western medicine, they are treating myocardial infarction in a localized way. They are doing the angiography and doing the arterial obstruction to disobstruct the artery that are obstructed causing myocardial infarction. But nowadays, some doctors that are doing the angiography and artery catheterization, they are seeing that some patients that are having myocardial infarction, they do not have any artery obstruction. And what is happening in these patients and the patients that are having artery obstruction? In traditional Chinese medicine, they understand that all symptoms presented by all kinds of specialties, the cause is not on the leaf. There is an energy alterations presented in this root that is causing the symptoms in the leaf level of this tree. And there is a communication of the root with the trunk and all the branches. But you can see that all disease came from the same energy alterations in this root. And when we treat these energy alterations in this root, we can treat all the patient's conditions such as emotional or physical symptoms at the same time. And this theory was presented by myself in 2015 at the acupuncture research conference that was held in Boston in the United States in the Harvard Medical School, showing that if we treat the energy alterations presented in this root, we can treat all the patient's conditions at the same time. And traditional Chinese medicine understand also the influence of the external pathogenic factors, such as the influence of cold, wind, heat, humidity, and dryness, that Western medicine doctors do not understand this influence, such as when you are submitted to wind or cold, you can begin to have alterations in having sore throat or fever, etc. And there are two theories in the root of the tree that I want to show to you. Is the yin and yang energy. They are opposite, but they are complementary. They need to be in equilibrium and need to be in harmony. That here. Yin and yang are symbolized by this symbol. Yang is symbolized by this white part and is symbolized by this black part. Yang is positive sunlight, heaven, active fire above heat and generation, and yin is considered negative, moon, dark, earth, passive, water, below, cold, and growth. And when there is an authority not having this equilibrium, when yin is less than yang or yang is less than yin, there is a formation of some symptoms in the leaf level. This is very common in women in menopause when they begin to have hot flashes, heat sensations, irritability, and this is very common in patients with diabetes. In all autoimmune disease has these energy alterations in energy deficiency. And yang energy deficiency is when the patient has cold hands and cold feet, and they can have tendency to have urine liquid retention and tendency to have urinary incontinence or rectum prolapse, etc. And all this reasoning began in 2006 when I treated one specific patient. I will tell you again his history to you to understand when I began to have this reasoning, treating the energy alteration and not just the symptoms. He was a 70-year-old male patient that was presented pain in the legs for about 6 months with no improvement of his condition, only using anti-inflammatory medication. And he went to my clinic and was searching for another type of treatment. Instead of treating his symptoms in the leaf level, the pain in the legs were considered the leaf level of orthopedic specialty. I treated his energy alterations presented in this root. And after 10 acupuncture sessions and changing his dietary aspect, he returned and said that his leg pain improved very much, but he also improved from another condition that I was not aware, that he had been treating for glaucoma for the last 40 years with no improvement, only using eye drops. And for the first time of his life, his intraocular pressure reduced for 40 to 17 mmHg. And his ophthalmologist asked him what he did during this period, because this was the first time that his intraocular pressure reduced in his whole life. And he said only he did only treatment with Chinese dietary counseling at that time and acupuncture. And in the root of and that is why I begin to participate in many conferences worldwide to show the importance to treat the energy alterations presented in the root and not just the symptoms. And this is the cornerstone of the treatment in traditional Chinese medicine, is to regulate these four energies that are presented inside the body: yin and yang, qi and blood. This is what we need to regulate in all patients in any kind of disease, the chronic disease. Yin and yang are two energies produced by the kidney. Qi is produced by the liver, and lung and blood is produced by the spleen. And all these energies regulate by the energy of the heart. This is very important because all this presentation is regarding these four energies that I will show to you again. When there is an energy deficiency of yin or yang or qi or blood, there is a formation of internal fire. How can you do the diagnosis of yin deficiency or yang deficiency or qi or blood? You need to ask the patient if they have hot sensations. If they say yes, this is yin deficiency. And if they feel cold feet and cold hand, this is yang energy deficiency. Qi is when the patient has abnormal sweating during the day, and blood deficiency is when the patient has abnormal bowel movement, do not have daily bowel movement. If the patient do not have daily bowel movement, these mean blood deficiency according to traditional Chinese medicine. And an energy deficiency or a combination of this energy deficiency can lead to a formation of this internal fire inside the body that's responsible for some clinical manifestation in the leaf level. For example, indeficiency and formation of this internal fire is responsible for the formation of diabetes in traditional Chinese medicine. And the combination of this energy deficiency and formation of this internal fire is responsible for all cancer formation. And many kinds of disease, all kinds of infections has this heat retention, such as community and hospital infections, and all kinds of emotional, such as anxiety and panic syndrome, also have these alterations presented in this root. In this presentation, I would like to show one case report that I did in my clinic in Brazil. I treat in Brazil. It's a 75-year-old male patient. He had 3 diagnosed Parkinson's disease, low back pain, and depression. And he was using levodopa, an anti-inflammatory medication, and antidepressive medication. But he was my patient, but he was not treating. He was didn't go to my clinic for 6 months, and asked my secretary to call him and asking him what is happening. And at the consultation, he bring many kinds of medication that he was prescribed by his neurologist to treat these 3 kinds of diagnoses. And all his diagnosis was treating the leaf level of this tree. He had in the neurology branch one Parkinson is a tremor in the hands, and he was having low back pain, is a leaf level of the orthopedic, and depression is a leaf level of the psychiatry branch. But at that time, I measured the energy of this root, and all this energy presented in this root was in the lowest level of energy without any energy. And all this medication that he had been treating, Prolopa, anti-inflammatory, and antidepressant medication, they were after ingestion, they were lowering even more the energy of this root that was already very low. But I asked him to reduce the ingestion of this medication and begin to use acupuncture and the homeopathy medication to replenish the energy of these organs. But he did not follow my advice, and after 2 weeks of this consultation, he had myocardial infarction at home and died. And this was his energy alterations presented in the chakras energy centers without energy in the liver, kidney, heart, lungs, in the spleen. And what I want to say is that the blood to circulate inside the body needs to have these four energies. And the blood can stagnate in any part of the artery when there is no energy in the yin yang qi. There is a reduce of this energy, can stop the flow of this blood inside the blood vessels. And that is why nowadays the majority of patients that are having myocardial infarction, they are having blood stagnation due to no energy in the artery to flow, normal flow of this blood inside the blood vessel. And that's why some patients are having myocardial infarction without arterial restriction. They're having myocardial infarction because the blood is stagnating in some part of the body, in this case in the heart. And the myocardial infarction is in the energy level. It's not occurring any kind of arterial obstruction. And even patients with arterial obstruction, they have these energy deficiencies in these five internal mass organs that even treating the myocardial infarction, disobstructing the artery of the heart, we need to treat this energy deficiency condition that is causing this less blood and less yin, less yang, and less qi to normalize the flow of energy in the blood in the energy level. And the treatment of these to replenish the energy of this organ is a theory created by myself in 2015 when I began to study homeopathy in Brazil. And after my study, I created this new theory treating the root and not just the leaf. And treating the root using sulfur to treat the heart, calcarea to treat the spleen, silica to treat the lung, and natrium muriaticum to treat kidney, and phosphorus to treat the liver. It is possible to increase the energy of these organs to reduce the chance to have stagnation of this blood in any blood vessels inside the human body. And these 5 medications needs to be used nowadays in any kind of persons to reduce the complication of the modernization of telecommunication. Even in children, in babies that are born today, they are in this lowest level of energy. And if we do not treat, they will have complications such as anxiety, depression, insomnia, problems in the memory and concentration. They could have more tendency to have diabetes type 1, type 2, and even cancer nowadays, and all the cases of thrombosis that is happening nowadays. And the preferred thing that we need to orientate the patient to regulate all these 5 internal mass organs is to orientate to avoid the ingestion of all these food, because all these first group of dairy products, raw food, cold water, and sweets can reduce the energy of the spleen and pancreas that is responsible for the absorption of nutrients and formation of blood. And if you do not absorb the nutrients from the food, you will not produce blood, and the whole body will have a weakness state, leading to difficulty in improving the energy. And avoid the ingestion of coffee, soda, and tea, because all these drinks can reduce the energy of the kidney that's responsible for the production of yin yang energy necessary to have the blood to circulate normally inside of blood vessels. And to avoid the ingestion of fried foods, eggs, honey, coconut, alcoholic beverages, and chocolate, because all these food can increase the formation of internal fire, and leading to imbalance of energy of liver and gallbladder, leading to more complications. And this is what I usually use in my clinical practice in Brazil, is an apex ear bloodletting, is a condition to take out the formation of internal fire inside the body, and the auricular acupuncture to regulate the energy of the kidney, liver, spleen, heart, and lungs. And this is the apex ear bloodletting. And this is the research that I did in my clinic in Brazil, showing that prior to the COVID-19 pandemic, the majority of patients were in the lowest level of energy, rated in 1. 1 means no energy in the liver, in the kidney, in the heart, in the lung, in the spleen. Here is the memory and concentration. At that time, only the spiritual chakra has energy, but nowadays, in 2025, they do not have the spiritual chakra also, because they are worsening their energy. And this is a treatment to replenish the energy of these batteries to work again, to do not have energy stagnation in any part of the body, leading to many kinds of thrombosis. All kinds of thrombosis, myocardial infarction, strokes, have in common this energy deficiency situation. And this is the Arne-Schulz law, created in 1888 by 2 German researchers. And they are saying that the use of any kind of high concentrated medication can reduce even more the vital energy. And if we reduce even more the energy of these patients that are having no energy in all these organs, we will leading to complication, leading to myocardial infarction, leading to strokes, and leading to less immunity or even death of this patient. And even medication to reduce the fever or any kind of high concentrated medication can lead to this problem. And that's why it's imperative to use nowadays only high diluted medication to increase the energy of our patients, to reduce the possibility to have myocardial infarction. And that's why homeopathy nowadays needs to not be in the second part. That is the second. Homeopathy needs to be the first medication to be prescribed in the whole globe nowadays, due to this energy deficiency condition of the whole population globally. And that's why this is the main time for homeopathy doctors to say that the only medication that we need to use nowadays is homeopathy, is high diluted medication and not high concentrate medication. And the majority of doctors nowadays are not aware of this alteration and continue to prescribe high concentrate medication that can lead to myocardial infarction. And the first choice of medication due to this change in people's energy is the use of homeopathy. Due to this new global immunodeficiency that's affecting the whole population globally for the last 10 or 20 years, 11 years. And here is the clinical characteristics in children in this new global immunodeficiency. We are facing children with low energy since they are born, since they are in the womb of their mother, because their parents are without energy. And in my clinical daily practice, I usually orientate the woman and man that wants to have a children to treat their energy deficiency condition, to have a healthy children without problems, without chance to have any kind of disease such as autism and other kinds of disease. Mateus. Here's another article showing which are the clinical characteristics of adults in this new global immunodeficiency, since all of the patients presenting the emotional part, such as anxiety, depression, panic syndrome, less memory and concentration, or even diabetes, thrombosis,
circumstances ഒക്കെ ഫേവർ ചെയ്യുന്നത് സൂയിസൈഡ്. ആ വീഡിയോ പുറത്താക്കിയതിൽ ദേവന്റെ പങ്കുണ്ടാവാം, പക്ഷെ ദേവന്റെ മരണം അതൊരു ആത്മഹത്യ തന്നെ ആയിരിക്കില്ല. ദേവന്റെ മരണത്തിന് ദേവിന് അയച്ച കത്ത് അതിന്.
Hi, can you turn off your speaker, please? Here's the article of this presentation, Can the medication we are prescribed cause myocardial infarction? In this publication, it is about this presentation. It was published in 2024. It was published for 1 year. And here is an article I published in 2020 showing all patients that are having myocardial infarction have in the background these energy alterations in the chakras energy centers or in the 5 internal massive organs of traditional Chinese medicine. And even we treat using modern Western medicine treatment, we need to know that we need to replenish the energy of these organs to prevent the second myocardial infarction or lead to death, because the majority of patients that are treating nowadays of myocardial infarction are receiving high concentrated medication, leading to more propensity to have another myocardial infarction. And here's another article published in 2022 showing that a patient that had received treatment of COVID-19 had myocardial infarction 2 days after his treatment. And in his exam, the arterial exam, he do not have arterial obstruction. And he received in this treatment antibiotics, anti-inflammatory medication, and so many medications that caused a reduction in his internal energy, leading to myocardial infarction. And also patients with congestive heart failure also have in these alterations in the 5 internal massive organs. And the main cause of myocardial infarction without arterial obstruction nowadays is deficiency of energy of the chakras energy centers caused by this new global immunodeficiency caused by the implementation of 4G and 5G technology. Patients with a stroke with or without COVID-19 also have these energy alterations that we need to use this treatment using high diluted medication to replenish the energy of these organs created by the theory written by myself titled Constitutional Homeopathy of the Five Elements based on traditional Chinese medicine. Patients that are having any kind of thrombosis, pulmonary artery thrombosis after COVID-19 treatment, this was very common in the pandemic, but all this was caused by the type of medication that they received in immune deficient patient due to energy deficiency situation. And that is why I wrote in 2021 why homeopathy is the medication of choice in the treatment of all kinds of disease nowadays. Because of these alterations in the energy pattern of the human body in the whole globe, we need to use more high diluted medication and not high concentrated medication, because high concentrated medication are leading to more immune deficiency, more tendency to have complication or even death of our patients. And in this article, I wrote in 2021, I think, why homeopathy is the medication of choice in the prevention and treatment of COVID-19 infection. In this article, I'm showing that all COVID-19 patients that are having COVID-19 have in common this energy deficiency situation in the root. And that is why if we use antibiotic, anti-inflammatory medication, corticosteroids, or all of the medication, use it in the treatment by the Western modern doctor, they should have complication or even death due to this energy deficiency situation. And the death in this pandemic was not caused by the virus itself, but the type of medication used in the treatment of these patients. And that's why we need to use more high diluted medication in the prevention using the biotherapy of SARS-CoV-2 and the homeopathy medication. And in elderly patients, the homeopathy or high diluted medication is the medication of choice to treat any kind of elderly patients, because they are having all these energy alterations presented in this root that we need to aware and avoid the use of high concentrated medication. Only to finalize this presentation, I would like to say that homeopathy and acupuncture in Brazil are considered medical specialty by the Federal Medical Council since 1980 and 1995. I know that there are some countries in the world that are not considering them as medical specialty, but they are very important tools to be used in this new type of population that we are facing nowadays, considered immune deficient due to energy deficiency situation. And this is the metaphor of yin and yang. We need to combine Western and traditional Chinese medicine and homeopathy nowadays in the treatment of these patients to do not have complications. According to Hippocrates, he said that it's far more important to know what person has the disease. The person that we are facing nowadays are considered immune deficient, and we need to treat this immune deficiency, treating the root, then to know which disease the person has. The disease is the leaf level. If we treat the leaf level, use high diluted medication, it's not as bad, it's good, but if we use high concentrated medication, we can induce more energy deficiency situation and can lead to complications, myocardial infarction, strokes, or even sudden death that's happening in the whole globe nowadays. Thank you for your attention. If you have any questions, I will be very happy to answer you. Thank you.
Yes, doctor, it's really a very good session. You really rocked the session. Unfortunately, there is some electric problem with me. And anyway, it's the time for discussion, and those who want to participate in the discussion, please raise your hand.
There is one
Yes.
doctor that want to ask.
Is really what is the percentage of success in your practice in cardiac cases?
I cannot understand. What do you ask?
What kind of success rate for in your cardiology cases?
No, I don't treat in acute phase the myocardial infarction because I work in my clinic, and the majority of patients that are having myocardial infarction, they are going to the Western medical doctor. But after this treatment, the majority of patients need to have this treatment to replenish the energy of these organs, because as the Western medical doctors do not they are not aware of these alterations, they are still using high concentrated medication, and that can lead to more complications or leading to more energy deficiency and leading to death of this patient in the near future. And that's why important.
Definitely, yes, but definitely homeopathy can do wonders in the treatment of cardiac cases.
Yeah.
A lot of homeopathic doctors are more than thousands of cases with them with the cardiac cases, and they're able to manage them without surgery, without any this angioplasty. Even
Oh,
patients who are afraid of all those surgery as well as angioplasty used to be treated with homeopathic medicine, and
oh,
they are able to manage them beautifully, just like
oh.
our counterpart is doing in other system of medicine. And the thing is that people don't have the belief and the information that homeopathy can do such wonders.
Yeah, we need to publish all
Yes, yes,
these.
yes, yes. We need to publish our, as well as we need to propagate all these things to the public. Then only the general public will come out and undertake homeopathy as the first system. And now Dr. Sridhara Kursa, the button from Homeopathic Fraternity, is here. Sir, you can speak now. Please unmute yourself and speak. Yes, Sridhara Kursa, please unmute yourself.
Yes. Whether it is audible?
Yes, yes, audible, sir. You can speak.
Madam, it was very nice, but I heard only after half hour only I heard, but it was very good. But I can assure, which is because of the fear, what I feel the people are not ready to treat, because now some of the few hospitals in Kerala, ICU also, they are ready to admit homeopathic patients, and they are ready to accept our patients. We can treat ourselves. I saw some of the addresses in some of the group I saw. So you can now, we have more, we can admit the patient and we can treat also. In emergency, they can transfer if we cannot control. If that we cannot control, then you can also the other there other these things ECG, that all the other things also investigations, so we can use such hospitals are also nowadays it is there. So it is a good opportunity for the homeopath. You must have a good what you call confidence, then only. Of course, I also 10, 15 cases in my lifetime, last 50 years. I got a few cases and I am very successful, but no, not knowingly. After I treated according to symptomatology, then I realized that I was not knowing it was really the acute myocarditis. But later, when I called to the that cardiologist, that he only told who treated it is that it is completely better. But in so many cases it was possible to cure because of our lack of confidence. It is not possible nowadays. Otherwise, we are not ready to take the risk. That is why. Up to certain extent it is correct, but if we may try, if we may take risk, and if we may know such facilities are there, IPD facilities are there, and investigation facilities are there, you can admit and you can do it better than that. Equally, you can treat so many so-called incurable heart diseases. That is my opinion. Thank you very much. Madam, your
Thank you for your
lecture was
comment.
very good. Come again, good subject. It is not easy to treat and get confidence in treating to the heart disease, because by hearing itself, we will get palpitation and fear, and that is the problem most of the time. If you are having good confidence, you are having courage, you can do it. Thank you very much. Thank you very much for your this good present.
Mhm. Thank you. Thank you.
Thank you, Sridhar Prasad. It's really a very great thing that homeopathy is doing for these myocardial conditions, particularly in chest pain cases that are coming in. But people believe that the modern medicine people can only do these things. But there are lots of homeopathic doctors doing such wonders. And if a person having a chest pain, you can definitely first, you take the first aid from homeopathic doctor, because we have arnica, gelsemium, all even carbobage. All these medicines do wonders as a primary treatment. What's your opinion on that, doctor? Have you ever experienced such medications as first aid remedies for cardiac problems?
Yeah, as the majority of patients nowadays are considered immune deficient. Even patients with arrhythmia and need to use pacemaker and congestive heart failure, all of them have in common this energy deficiency situation. And that's why in my clinical practice, I only replenish the energy of these organs and take out the internal fire that I showed in my presentation. And all the patients can improve their conditions without using any kind of medication or treatment. As I showed, the medications nowadays are causing more complicated, high concentrated medication. And that's why the majority of them, I orientate them to reduce their medication and replenish the energy of these organs, combining.
Okay.
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 And
Okay. Okay. Now I invite Dr. Susie Sariga to say vote of thanks to the session. Please unmute, Doctor. Dr. Susie
Okay.
Sariga, you can say vote of thanks to the session. If you are listening, you may please unmute yourself and you can speak. Please unmute. Okay. It's not responding. So I am inviting Sridhar Prasad to say vote of thanks to the session also.
Yes, madam. It was very excellent session, and it is not so easy to get confidence in treating that, especially heart diseases. But anyway, your lectures were very good, excellent. It is getting confidence to this forum. Come again with such a beautiful sessions. Thank you very much for your coming for these things. Come again. And I thank each and every person who are listening here, that about 35 persons are still there. So I thank each and everyone in behalf of IFPH. Thank you, one and all. Good night. Good
night.
morning, good night, and good afternoon. Okay. Thank you very much.
Thank you, Sridhar Prasad. Tomorrow we will have a session from Dr. Najib, and Doctor will be talking about back intermittent fasting part 2, and the subject of discussion will be back to you with fasting. So that's another interesting subject coming on tomorrow. Hope all of you will join us tomorrow at the same time at 8:30. Thank you all. Good night. Thank you once again, Dr. Huang Wei Ling. Hope we can have some more presentation in the future.
Okay,
Thank
thank
you
you.
all. It's over to Dr. Maria Majon to moderate